Liposuction and fat transfer is no doubt a very common plastic surgery. It is reportedly the most sought after plastic surgery in the world, yet many people don't know much about it. In this video, I'm going to tell you all you need to know about liposuction. My name is Glory Udom and you are welcome to my channel. I am a medical doctor currently serving in Abuja, Nigeria, and I make videos on medicine, sewing, productivity and entrepreneurship. In this video, I'm going to tell you what liposuction is, types of liposuction, and 5 things you need to know about liposuction. Disclaimer, I am not a plastic surgeon. I am a medical doctor working in a plastic surgery clinic. So let me just take a step back and explain that. In Nigeria, medical school is 6 years. After medical school, and you go for a 1-year internship, which is houseman, also known as housemanship or house job. After that, in this country, you're required to serve. It's 1-year compulsory service to the government, basically just working. After that, you can then now decide to further your education by having a residency. Now, it is during this residency program that you can now specialize to become a surgeon and then further subspecialize and be a plastic surgeon. So I am not a plastic surgeon. I am a medical doctor working in a plastic surgery clinic. My time in this plastic surgery clinic has really made me aware of how much little information people actually have on plastic surgery procedures, especially around here, and that's why I'm making this video. So liposuction is basically a surgical procedure where fat cells are removed basically by using suction. How it's typically done, most commonly, is after tumescent fluid is being put in the areas where we want to remove fat cells from. What this tumescent fluid helps us to do is to reduce bleeding from these areas. The fat cells are then broken down and then sucked out with a suction machine. Areas that are most commonly lipoed include the abdomen, the back, the flank, the neck, yes, to get a better cervicomental angle, and then the thighs. Those are some of the areas that are most, there are many other areas that are lipoed, but those are some of the areas that are most commonly liposuctioned. So the types of liposuction, a very common type of liposuction that is used is power assisted liposuction. Okay, here we can see that the cells are mechanically broken down and then sucked through the cannula into the canisters. Yeah, these are the canisters. In a laser, another type of liposuction is laser assisted liposuction. In laser assisted liposuction, there is a laser beam that is placed at the tip of the cannula, and from here the fat cells are broken down, burned and coagulated through the laser and then sucked out into the canisters. In ultrasound, another type of liposuction is ultrasound assisted liposuction. 5 things I think you need to know. Now, before I get into that, commonly after liposuction, that's removal of fat in some of these areas, this fat is usually transferred. In some cases, transferred to other parts of the body, most commonly the butt and the hips and then the breast. 5 things I think you need to know about liposuction. Number 1, liposuction is not primarily a weight loss procedure. Yes, you can lose weight after liposuction, but it's not primarily a weight loss procedure. Let me explain that. In each sitting, there's a limit to the amount of fat you can actually take out. So sometimes this amount of fat might not drastically reduce your weight. It will improve your figure, but not drastically reduce your weight. It is not necessarily a weight loss procedure, which is why we advise that after liposuction, people keep diet. Even before the procedure itself, you diet, exercise, and try your best to lose weight before even coming for the procedure. And then after the procedure, you keep on doing that. That's the best way to lose weight. And there are a couple of other weight loss, there's some surgeries that are particularly for weight loss in cases of obese people, which is another topic for another day. Number 2, the second thing I think you need to know about liposuction is that liposuction does not affect childbearing. Yes, I had someone ask me once that should she go ahead and do liposuction now when she has not had children? Won't it affect her children? No, it doesn't affect childbearing. Liposuction does not reduce your chances of getting pregnant or carrying your pregnancy to term. and having a safe delivery and all that, liposuction does not affect childbearing. The third thing I'd like you to know, I think you should know about liposuction, is you need to have complete faith in your plastic surgeon. It's easy to think that this procedure is easy to do, but complications can arise from this procedure. What if something happens? If the person is not first a surgeon, before he even is a plastic surgeon, if he's not first a surgeon, he might not know how best to handle these complications, which is why I would always advise anybody, always make sure you use a qualified plastic surgeon for your plastic surgery procedure. And the fourth thing I think you need to know about liposuction is that men can have liposuction too. Men do have liposuction too, yeah. So most commonly of the abdomen, just to reduce the abdomen before they start, working out to get those chiseled abs, or men do frequently have liposuction. Fifth thing you should know about liposuction, because I've had people ask me that too commonly, and it's a frequently asked question about liposuction, is, are the results permanent? Like, when the fat come back? Now, the results, that is both a yes and a no answer. I'll explain. After liposuction, your figure is improved. We've taken out fat from different parts of your body. Your abdomen is flat now, and probably the fat was transferred to your butt, so you have a fillet. Now, the fat that was taken out, they're no longer there. They're gone. So in that sense, it is permanent, because the figure that you've attained now, is going to be there. However, without adequate exercise and dieting, if you do not take care of this physique that you've acquired now, you can gain weight back, even in the areas that you lipoed. The fact that you did liposuction in some particular areas doesn't mean fat can never grow back there. There are cells, you're a living thing, and cells will most likely grow back in those areas. So thank you for watching the video. I hope I didn't bore you or didn't confuse you, and I hope I gave you value. If you have any question, please feel free to ask me in the comment section. And if you like me to keep, because I'm currently working in a plastic surgery clinic, and it's been very, very, very expository, really. It has taught me a lot of things that in this area is not really a lot of things are not being said about those things. If you'd like me to continue making content like this, plastic surgery related content, please just let me know in the comment section, and I will be happy to do so. So thank you so much for watching. Don't forget to subscribe. Don't forget to like. Don't forget to share. All right, thank you very much. See you in my next video. Bye.